Okay, that's great. So I think we've started. So we're really delighted to be joined by Dr. Corinna Grindle, who's a board certified behaviour analyst at doctorate level. Dr. Grindle has over 2 decades experience in supporting children and young people with intellectual and developmental disabilities, including autism. And her research interests have been in early intensive supports and the application of applied behaviour analysis, as well as enhancing academic outcomes. So more recent work from Dr. Grindle has focused on improving access to the general curriculum for children with moderate to severe disabilities. And then this paper that we'll be discussing, or she'll be discussing this evening, is on the collective effort to enhance the quality of research evidence in intellectual and developmental disabilities, and specifically the work of the Sharland Foundation. So this is an area that I'm very interested in, so I'm really delighted that you could join us to talk about this evening. So shall I share my screen and we can make a start? Would that be okay?
Yeah, that's good.
Excellent. Bear with me there a moment.
So Alan and I had a little practice about 10 minutes ago, and it wasn't possible for me to be able to share my slides in quite the correct way. So Alan is going to be sharing them for me and is going to be moving on when I ask him to. So yeah, sorry that there'll be a break in between the slides as I ask Alan to move them on. So thanks very much for that lovely introduction. I really appreciate it. I've been really looking forward to this presentation. I have just had a big cup of coffee though, because I wouldn't usually be presenting at this time in the evening, but I'm ready to go. I've had my coffee now. So yes, I'm going to be talking to you about the work of SF-DDARIN. So if you could move on then, Alan, to the next slide. That's it, brilliant. Okay, so you're going to hear me talking about SF-DDARIN a lot. Okay, it's a shortened term and it stands for the Sharland Foundation Developmental Disabilities Applied Behavioural Research and Impact Network. So obviously that's a huge mouthful to be saying all of that in one go, so that's why we have shortened it to SF-DDARIN. Okay, so what are we all about as a network then? Well, we're basically a collaborative, as Alan was saying, a collaborative network of researchers and practitioners. And we're really working together to achieve our overall aim of trying to increase the reach and impact of evidence-based behavioural intervention for children and adults with developmental disabilities to support their independence and increase their quality of life. So just moving on, Alan. So in SF-DDARIN, we currently have 39 active members. 23 of those members are academics. Many of them are researcher practitioners, so I would count myself as a researcher practitioner, and they span across 10 universities that are based across the 4 nations. And we've also got 16 practitioners as well that work across 11 applied settings. So those applied settings, it includes ABA practitioners that are working in schools, maybe working in colleges, or other community service settings for individuals with a developmental disability. Now, SF-DDARIN, it was set up and established in 2016 with funding from the charity, the Sharland Foundation. And it's basically a collaboration between the University of Warwick, Bangor University, Ulster University, and also the Tizard Centre at the University of Kent. So next slide, please. Okay, so the network is basically directed and managed by a core management team. So this management team basically oversees and prioritises network projects, decides how resources are going to be spent, how they're going to be distributed and allocated. And the management team, it includes members from those different collaborating universities that I just mentioned. Now, it's really important just to point out at this stage as well that the time that the individual network members and also the time of the management group members, the time that they put towards contributing to SF-DDARIN projects and activities, that time isn't funded at all. Okay, so the network members and the management team members, they're doing their contributions to the network in their own time. So what the funding from the Sharland Foundation goes towards paying for is it goes for to pay for a small amount of time from the network manager. So that's me, I'm the project manager for SF-DDARIN, as well as funding time for 2 part-time postdoc researchers and a PhD student who helps with admin support. So funding for this small sort of group of people is absolutely crucial in helping to develop and move projects on when there's no other sort of external funding often that is coming in. Okay, so next slide. Okay, so just to explain a little bit about the rationale for developing or setting up SF-DDARIN in the first place. So the key people that were sort of behind the original idea of SF-DDARIN, who helped to get it established initially and who applied for funding from the Sharland Foundation, that basically through discussions and meetings had come to the realization that even though behaviourally based intervention approaches were being recommended in several government guidelines, including the NICE guidelines in the 8 areas that you can see listed on this slide, it was still felt nevertheless that there was much that could be done really just to improve the evidence base for behaviourally based interventions for individuals with developmental disabilities. So it was felt really that there was not really enough, or there was a lack of high quality research studies that provide strong evidence for behaviourally based interventions. So that really was the rationale for setting up the network in the first place. Now, just next slide, please. Now, one of the ideas really that helped from the very beginning to frame the focus of the work that we do at SF-DDARIN was this realization from some of the founding members of the network that developing adequate evidence for an intervention such that it is possible to say that an intervention has got a strong evidence base, that it should really be viewed as a journey, okay? And in fact, as you will come to see in this presentation, it can be a very long journey indeed, and can be one that takes many years. I just see somebody has said that the slides aren't moving. Is that the same for everybody? It should be on a slide that says evidence as a journey and a long one.
Yeah, it looks like that's the same for everyone. Could someone else confirm that, please?
Okay, all right, that's good. So maybe it was just not moving for somebody else. Okay, perfect.
Okay. Thanks for that, James. Maybe if you try refresh your screen or something, it might sort it out for you. Okay, perfect. So we'd started to view this idea that developing this evidence base can be a very long journey indeed. So some of the research areas that SF-DDARIN has focused on that I'm going to be highlighting to you today that have come about through collaborative sort of working of the network members, what I'm hoping is that they're really going to help to showcase a very systematic and well thought through long-term research program aimed at developing
effective evidence-based behavioural approaches that can be used in lots of different settings with autistic individuals and individuals with an intellectual disability. Now, it's really important as well just to emphasise that the long-term research programme that we've really been sort of focusing on, it has very deliberately been strategically aligned to best practice frameworks for developing evidence in terms of the recommended research phases to go through, or the recommended journey to evidence-based practice. Now, it's interesting to me that these frameworks actually, and there's a few of them, and I'm just going to talk through one main one today. These frameworks are actually quite common in health and social care, research for health and social care interventions in particular, but they're less common or less well known, I suppose, in our field of work. Okay, so next slide. Okay, so we started the network then with an understanding and realisation that the journey towards implementing evidence-based best practice, it's often a slow one. And we know that the gap as well between research evidence and the successful implementation of the knowledge that comes from research is often very wide in terms of practitioner knowledge of best practice or knowledge of best evidence, and the time that it takes for evidence to reach practice. So that's something that I'm sure all of you are sort of very well aware of. So I'm sure you're aware that this is a very hot topic, if you like. So how do we know which educational and which psychological interventions are evidence-based for the individuals that we work with? Now, the problem really is that there's no right answer. Lots of experts have got lots of different opinions about what constitutes whether or not there is an evidence base for an intervention. So it's sometimes really difficult to know who to believe, really. So what I'm hoping to do in the session this evening is just really to describe a tool that I think can be really very, very helpful indeed, that might help you then be able to draw your own conclusions and ask the right sort of questions as to whether or not an intervention has an evidence base or not. So it can be really helpful just to think about a process for the development of evidence, or the development of evidence for interventions that can be represented on a continuum, okay, like you can see on this slide. So Thornycroft, Lemp and Tanzella in 2011, they described a model of the process of development of evidence, which basically emphasizes increasing evidence from the left to right, okay, when thinking about the evidence space. We can be using this and it can be really helpful. So I'm just going to talk you through now the different phases, okay. So starting with phase 0 or phase 0, the idea of the model really is that basic science or theory should really be informing the interventions that we decide to use in the first place. So this is phase 0. Okay, so what this means really is that in essence, because any intervention should be informed by the latest understanding of a diagnosis, or the latest understanding of difficulties that the individuals we work with face, the interventionist should also be able to say what it is that they are trying to do and what is the theory behind what it is that they are trying to do. So the fact that phase 0 is called basic science is, I think, is really important. Okay, so for me, this means that it's not enough to be able to describe what you are trying to do with an intervention. What it means is that your story really needs to be evidence informed as well. So, for example, your intervention might be informed by knowledge about common difficulties that autistic children often face, maybe the strengths that they have as well, existing knowledge about the way that autistic children learn, or maybe sort of theoretical understanding about typical child development. So what are the key skills that autistic children need to learn from our understanding of typical development? What are those key skills that would be really useful to be able to teach? So whatever intervention is going to be studied in the later stages, there really needs to be those sort of theoretical underpinnings at phase 0. So just moving on to phase 1, what Thornycroft et al. Are saying here is that really at phase 1, an intervention should be very clearly defined or described, and ideally written down in detail in a form of a manual for those that are going to be using the intervention. Now, at phase 1 as well, the competencies needed to deliver an intervention also probably need to be described. At phase 1, it might be here that training or supervision models are also developed and tested as well. And at phase 1, there would also need to be incorporated into the research ways to check whether or not somebody is properly delivering the intervention. So are there ways to check that they're delivering the intervention with fidelity? And then at phase 1, what can happen is that this sort of new intervention, it can be subjected then to initial testing. So this is basically just trying it a little bit, measuring some outcomes. And then it's also just worth mentioning as well that the outcomes that you are wanting to measure in this phase 1, they would also ideally need to be really closely related to the underlying theory. So what exactly are you trying to change through running the intervention needs to be really clearly considered. And why is it important to be looking at those outcome changes as well? Now, at some point in phase 1 and probably in preparation for phase 2, we might also expect to see a pilot or feasibility randomised control trial conducted. Okay, so if you're using that design, the participants, so that could be autistic children, for example, they would be randomly assigned to receive the intervention or to receive some other intervention, which might be existing practice, or perhaps to receive no intervention at all. So at phase 1, a pilot randomised control trial would basically test out everything that would be needed ready to run a definitive randomised control trial at phase 2. Okay, so pilot randomised control trials at phase 1, they're not really designed to answer the question as to whether or not an intervention works or whether or not it's effective, but they're rather designed to test feasibility of all sorts of things, such as the feasibility of using the recruitment methods, the feasibility of the randomization procedure, testing the feasibility of those sorts of things that might be required to know that it's feasible to do those things before running a full-scale efficacy RCT at phase 2. So just at phase 2 of the development of the evidence. So here you've got research studies that are probably larger scale randomized control trial studies, and they're carried out to test whether or not an intervention can work. Okay, so at phase 2, this is a question of what we call efficacy. Okay, so this is whether or not, given very well resourced, well trained, very experienced and supervised interventionists delivering an intervention with optimal fidelity, can the intervention under those conditions be shown to work? So it's really important just to recognise at this stage at phase 2 that these studies are not designed to tell you whether or not an intervention will work when it is implemented in real-world settings with less expert interventionists. So basically, it's not designed to let you know if the intervention works under less than ideal conditions. Now, too often what happens in the development of evidence for an intervention is that the development of the evidence stops at this phase 2, okay? Or what might happen is that researchers focus on this aspect of the evidence. So they may say, okay, well, there is an efficacy RCT, so that's great. We can now roll it out into practice, okay? But hopefully you can just see through seeing this continuum that according to Thornycroft et al., if you stop at phase 2, that is far from the end of the story with regard to what you should be thinking about with regard to developing evidence for an intervention. So the next phase then, phase 3, this is all about carrying out research to test the effectiveness of an intervention. So whether or not an intervention can work under optimal conditions, of course, that's really important to be trying that out and testing that, but whether or not it still works in practice under less than ideal conditions, this is really important as well, and it's a question as to whether or not the intervention is effective. So these phase 3 research studies, they can often be randomised control trials again, and the focus might be here on whether you're able to train people that are not experts in an intervention, such as, I do education research, but teaching assistants, dinner ladies, I don't know, just typical staff in school settings. Can they be trained to deliver an intervention? And do you still get similar positive outcomes under those conditions that as you do in phase 2? Now, phase 4 is then just about how do you scale up the delivery model to how do you scale it up to be able to deliver the intervention as a part of standard services. So in health context, some of you might have heard this phrase that people often talk about care pathways. Okay, so how can the intervention basically be incorporated into existing care pathways and still be delivered in a way that leads to really good positive outcomes? So if you're thinking about implementation studies at phase 4 in educational contexts, questions such as, how can the intervention be delivered in classrooms in multiple schools, for example, across local authorities or across counties? How do these interventions dovetail with the national curriculum? Those sorts of things. So they're the sorts of questions that can be subjected to research under phase 4. Okay, so just next slide, please. So just to deepen your understanding of the model just a little bit further, Thornycroft et al., they also point out that there's 3 points along this continuum where evidence can get the storyline with the evidence can get stuck in a sense, and they call these translational blocks. So at phase 0, the first translational barrier is here, and it, to illustrate that block, it can be that many basic science findings, they might end up not being translated into useful interventions at all. Now, this has often been pointed out as a criticism of lots of the research in the field of autism. So I'm sure that you're aware there's a great deal of basic and experimental research on autistic children, but there's much less use of this research that is used to inform new interventions. Okay, and in some cases as well, the results from this phase also may just not translate very well to the wider population. Okay. So it might be when promising approaches or interventions that are identified in phase 0, they just basically fail to gain traction. So an additional barrier as well that some researchers often face, I've been there myself, is that there's a lack of financial funding or financial means or stakeholder buy-in to be able to move on to develop the next phase of research. So there is this next translational block at the end of phase 2. So this is obviously when research can demonstrate that an intervention can work under those optimal conditions that I was talking about, but then everyone relaxes thinking that's enough to get on and use that intervention and roll it out for service delivery. Okay, so that really sort of just represents an interface between the outcomes of research from efficacy designs and those conducted under real world conditions, where there is a lack of support from researchers or experts. There might be, as I was saying earlier, teaching assistants or classroom assistants at phase 3 that would be expected to deliver the intervention. So what we often see is sort of lower effect sizes at phase 3 than we do at phase 2. And then there's this final translational block at the end of phase 3. So this is when interventions that have been tested in effectiveness studies, that the research sort of stops there, and there's very little then research evaluating whether or not the interventions can still work when they are rolled out as part of standard delivery. Okay, so just moving on. Okay, so what I'm hoping by this point with me talking through this model is that you're beginning to maybe get a bit of a sense as to how you could potentially use the Thornycroft evidence tool. So what it will hopefully do is it will help to prompt you to consider what questions a particular research study is asking about an intervention. So the phases of the model can really sort of help to clarify the questions that you could be asking. So if somebody, for example, is describing to you, or you're reading about an early study that is designed just to generate initial data on a recently defined new intervention at phase 1, okay? So if you're reading about a study there, it might be that the research design is not very strong or sophisticated, okay? But that doesn't mean that the research at that stage still, can still be really important as well. But what you could be doing at phase 1 is you could be asking questions about the theory that is underlining the intervention. Okay, so hopefully the researchers would have been able to really clearly articulate the theory that is underpinning the research in the first place. So a good idea basically isn't enough. There needs to be theoretical sort of underpinnings to the research. Now, if you are reading about results from a randomised control trial, you can be asking yourself questions about, well, at which phase along this continuum is the randomised control trial? So you can be asking yourself, is it an initial pilot trial at phase 1? So if that's the case, it's obviously not definitive evidence. Is it a randomised control trial, which is testing out whether or not an intervention is able to work under optimal conditions at phase 2? Is it a randomised control trial testing effectiveness in more typical settings, and so on? So don't just accept a randomised control trial at face value and think, oh, wow, that's really good, it's an RCT. You can be sort of thinking about where it falls on that continuum. Now, it is just worth pointing out as well that in practice, you will find, obviously, a lot of the time that the evidence for interventions doesn't follow the full continuum, okay? And there's lots of quite sensible, pragmatic reasons as to why that might be. The most obvious one really is that, as I was indicating earlier, is it can take a really long time to be developing evidence throughout this whole continuum. And it has actually been pointed out as well that the journey going from basic science in phase 0 up to the implementation phase can take, you know, 2 decades or even more than 2 decades. So it's obviously, you know, if you're going along the whole evidence continuum, it can take a long time. So it's perfectly okay to be taking pragmatic decisions, I suppose, about what evidence is most needed now. We obviously can't be sitting around for 20 to 30 years to thinking that we need all of that time to be developing evidence-based interventions all the time. We often need interventions now, or we need them very soon. But I suppose the point that I'm trying to make is that even if we recognise that, that is not really an excuse for poorly designed research. So researchers, if they have in mind about this continuum, they can be much more transparent then when they're writing up their research about the bigger picture and where their research that they're doing falls on this continuum, and where research could potentially go in the future. Now, what about the state then of the evidence for behavioural interventions for autistic children and children with developmental disabilities? So you will see I've got these 2 circles on here. You might have been wondering why they're there. So the yellow circle is just basically to highlight what I'm sure you're probably already aware of, is that there are very few efficacy RCTs of behavioural interventions. Okay, so why is that the case then? Why are there so few efficacy RCTs? So probably is safest to say that no one really knows for sure. There's probably lots of different reasons. But historically, one thing is certain, that when behaviour analysts were first designing and researching interventions for autistic children, in particular, ABA interventions for autistic children, around 40 years ago or so now, I think there was, well, I know that there was much less clarity then about the importance of efficacy RCTs. And then a problem has also always been about what exactly should the comparison be in an efficacy RCT. So it touches on an ethical point as well that lots of researchers have made, that random allocation to an intervention, it's ethically complex, of course, when there is already some evidence that already exists that a particular behavioural intervention might be very beneficial. So there is that ethical debate that is important. And then the final phase then, phase 4, we've got very few studies of behavioural interventions where there is research demonstrating that interventions can be very effective when they have been scaled up for much larger delivery as part of standard services. Okay, so just the next slide, please. So just changing track just a little bit, it is just worth pointing out as well, as I was saying earlier, sort of education research is my area that I focus on, but it's just worth pointing out that there is a growing policy move now towards encouraging the use of evidence-informed or evidence-based approaches in schools, which is absolutely brilliant that that is happening now. So the paper that I've put on this slide, it's a really good paper, I think it is, that discusses how the framework that I've just been talking through with you can help educational researchers consider their research questions and methods in a much more systematic way. So they can be using this framework to help conceptualize the journey from evidence-informed to evidence-based for educational provision Okay, so having this knowledge can really help policymakers and educators really make better informed decisions as to whether or not they should be investing or buying into particular interventions and promoting them in schools. So just to sum up, I'm going to move on. You'll probably be pleased to know I'm going to move on from talking about this framework now, but just to sort of really emphasize that I think the framework helps to just really provide a way for researchers and research-informed professionals to critically appraise research evidence that they're reading. It helps them, I think, to identify the sorts of questions that they should be asking when they're reading research. And for researchers, it can really help them plan for long-term research programs as well, that builds knowledge along the continuum. Okay, so next slide. Okay, so as you will see in a minute, over several years, the SF-DDARIN network, the network members have really started to try and implement a systematic and planned research program using that continuum to underpin the work that we do. Now, it's also just worth drawing your attention as well to the fact that not only are there very few RCT evaluations of behaviourally based interventions, but there's also been a real lack of attention by researchers in our field of using evidence synthesis methods such as systematic reviews and meta-analyses. Now, these methods, they're often regarded as gold standards, okay, within the scientific community. And because they are really considered to be gold standards within the scientific community, what that has sadly meant for us as a field is that some behavioural interventions that may very genuinely have lots of value and lots of potential use for the individuals that we work with, that they're not being routinely included in evidence-based practice reviews. Okay, so this in turn as well has probably contributed to there being a real lack of understanding of behaviourally based interventions outside of our field, and I think has potentially then limited the dissemination of behaviourally based interventions to the very key stakeholders, so children and adults with intellectual disabilities and their families. It has limited the dissemination and the use of these for those individuals that would really benefit them. Okay, so next slide. So what have we done at SF-DDARIN to try and move forward or solve this dilemma, I suppose? So what we've been really trying to do is not only to increase the quality of evidence for behaviourally based interventions, but we've also really tried to contribute to increased understanding and dissemination of these interventions to key stakeholders. And we basically try and do this through these four interlinked areas of research. So conducting high quality research, conducting special projects with a focus on impact, influencing professionals, and dissemination through mainstream and social media. Okay, so if you could click again. I'm just going to start by talking you through what we have been doing with developing our high quality research. Okay, so just click again. So at an operations level in SF-DDARIN, basically we organise our efforts through having two work streams, okay, that focus on two areas of behaviourally based developmental disability research. So we've got one work stream which is teaching skills to children, young people and adults, and the other positive behavioural support across the lifespan. Now, each of these work streams, it's co-chaired by 2 network members and supported by one of the postdoc researchers. And there's also additional research assistant time available for cross work stream activities. Now, these 2 work streams, they meet monthly, and they're expected to submit project proposals that will result in a range of outputs that might include research projects, practice or academic articles, and grant applications. Okay, so next slide. Okay, so to address the identified gaps in the evidence for behavioural interventions, based on the continuum that I've just outlined to you, we work through these different stages. So first of all, we look at defining a problem, initial testing and evaluation of interventions. We then look to develop a description model or manual for an intervention so it can be delivered easily in applied settings. We look to conduct more robust pilot studies and research, including small randomised control trials. We conduct systematic reviews and meta-analyses. And then with all of the evidence gathered from these earlier studies, what we hope to do is have sufficient evidence to put together for major funding applications to deliver large-scale randomised control trials. Okay, so the next step, next slide. Okay, so that we can sort of work through those steps effectively within the 2 work streams, the SF-DDARIN activities are organised across the 3 tiers that you can see here. So tier 1, it focuses on broad collaboration across small-scale projects, and these usually come from masters and PhD projects. We've got tier 2 activities, so this is focused collaboration on small to medium projects that are proposed by the 2 work streams, and these are those that can be resourced within the network and don't require any additional funding. So at tier 2, the focus here is really on sort of pivotal projects that we think are a necessary step to complete before being able to take a project forward to tier 3. Okay, and then we've got tier 3, so that is obviously it includes larger scale projects such as randomised control trials. And often at tier 3 as well, what we do is we establish smaller working groups of maybe 2, 3 or 4 people to really focus on the work that needs to be done to take a project forward. So next slide, please. So what I would like to do now is just to sort of quickly talk you through how activities across the tiers are organised and the progressive research or evidence steps that have been achieved by network members when looking to develop an evidence base for teaching people with developmental disabilities to read using the Headsprout Early Reading programme, which some of you might be familiar with. So next slide. So at tier 1, SF-DDARIN basically supported the write-up and subsequent publication of a study looking at teaching early reading skills to adult offenders with intellectual disability using Headsprout Early Reading. And that was actually the first study that had looked to see if Headsprout Early Reading could be used with an adult population. And we also supported 3 master's students as well to conduct studies in special schools looking to see if Headsprout Early Reading could be used to teach non-vocal children to read. Okay, next slide. Okay, so you can see there that we had some nice publications from those tier 1 studies. And then moving on to the next slide. At tier 2, for the development of the evidence for Headsprout Early Reading, the teaching skills workstream also developed a manual to help parents and teaching assistants support children with developmental disabilities using Headsprout. And this outlined basically additional teaching supports that would be helpful for children to be able to progress through the episodes. The group as well also here supported a single blind pilot randomised control trial with 55 pupils in a special school. And there was another study here as well designed to see if it was feasible to train parents up to support their children with accessing Headsprout in a home setting. And then the teaching skills work stream as well also conducted an adult reading skills survey amongst support workers with the aim of trying to get a better understanding really of how many adults with developmental disabilities have difficulty reading and whether or not they would be really interested as adults about learning to read and improving their reading skills. Okay, next slide. Okay, so those tier 1 and those tier 2 activities that I've just quickly described to you, they were all absolutely instrumental in us being able to be successful with 2 large grant applications that we submitted that you can see on this slide. And actually the Harris study, which was a cluster randomized control trial in special schools, was the largest ever trial that has been funded in the UK for special school research. Okay, so just moving on. Okay, so this is just, I'm not going to talk you through all of the steps here, but this just also illustrates how we have, in a similar way, look to be developing the evidence for a numeracy intervention to be used with children and young people in special school settings. So we started with a very small pilot study. We systematically worked through the first studies. We had experts delivering the numeracy intervention, and then we moved on to evaluating whether or not just a typical school delivery model with teaching assistants delivering the intervention would still be really effective, which luckily for us, it was. So next slide, please. And we're not stopping there either with our developing the evidence base for the numeracy intervention. So we're still looking, the work that we're doing at the moment, we're translating the curriculum into Arabic, and we have a PhD student who's working with families in Saudi Arabia, training up parents to be delivering the translated version of the curriculum with children in the home. So what we're hoping is that all of the evidence from all of those studies are again going to be instrumental in helping us ultimately do a definitive randomized control trial. So it's been taking quite a while. I don't know if any of you noticed on the slide that has just gone, the first pilot study was 2014. So we're 2024 now. So it has taken 10 years of my life to be coordinating that program of research. I think there probably is another 10 years in it as well. Okay, so I've talked you through just a little bit about I've given you 2 examples there, haven't I? The Headsprout early reading research and the numeracy research as well. If you could just move on to the next slide. Okay, so I've spent a lot of time talking about the development of the research evidence, but just to finish, what I would like to do is just to quickly talk you through some of the other areas of work that is the focus of SF-DDARIN. So we also have this focus on conducting special projects with a focus on impact. So these sorts of projects are really of national significance, okay, with implications for policy as well. Okay, so next slide. So one really important example of a special project that comes under the SF-DDARIN umbrella is the work of the PBS Academy. Now you can Google this, the PBS Academy has got its own website if you're interested, but It's basically an informal grouping of professionals from different PBS training organisations, from charities as well, from service provider organisations and academics as well. So all of these professionals are interested in the development of PBS and the establishment of best practice. Okay, next slide. And what they are trying to do is they're trying to work together in lots of different ways just to try and translate all of the knowledge that is out there in the research publications into best practice delivery. Okay, next slide. Now, more recently, the PBS Academy has also been working very closely with the Care Quality Commission to try and help improve the inspections of services that support people with developmental disabilities. And this project has produced two key outputs, so a quality of life framework and a quality of life tool. Now, the quality of life tool is currently being used by inspectors on site visits. And what is crucial about what is happening here is that the inspectors are using the framework to look at how well people's care plans are being delivered in practice. So really focusing on the actual experiences of people rather than how providers are describing the support. Okay, so next slide. Okay, so how do we go about influencing professionals, or how do we try and go about influencing professionals? So next slide. Okay, so what we try to do here is we try to influence professionals by publishing a whole load of case studies, clinical examples, intervention manuals and protocols, and detailed program descriptions that can, really hopefully help to address common problems that are faced when working with autistic children or children with developmental disabilities. So there's just a few examples of how we've done this listed on this slide. So just to take one of the examples, SF-DDARIN has recently contributed to a Cerebral report last year, highlighting the importance of investing in early intervention. So this included a case study on the early positive approaches to support, or EPATS, which is an early support program for families of young children with suspected or diagnosed developmental disabilities that was developed by one of our members, Nick Gore. Next slide, please. Okay, and then the final area then is that we try to regularly disseminate network outputs and projects into mainstream and social media as much as possible. So what we're really trying to do here is to generate as much positive press for behaviourally based interventions and developmental disabilities research as possible. So next slide. Okay, so we do this in a number of different ways. So we publish a wide range of stories, news articles, research papers. We publish about upcoming events and guidance documents that may be of interest to people that are interested in behavioural science and its applications. We've published several press releases as well about SF-DDARIN work, and we regularly put stuff out on Twitter and X as well, and we've had lots of views of our posts over the years as well. Okay, next slide. Okay, so we hope that the dissemination that we do, that it has lots of different purposes. So obviously we want to really be able to share the research and activities more widely. We also want to share stuff in accessible ways as well. So we've actually got a project that we're working on at the moment where we're working with a team of family carers to co-produce accessible summaries of research that can be disseminated to family carers of autistic children and children with a developmental disability. Excuse me. Okay, so just to finish, I would like to just summarise some of the impact of our work. So since SF-DDARIN started in 2016, network members, we've published or we've worked on more than 53 projects. We've had over 120 schools, special schools contribute to projects. And we've supported 12 PhD students and 13 master's students projects as well. And we've also collaborated on 78 published articles as well. Lots of different research presentations, workshops as well. Next slide. And then just as well, I'm coming to an end because I'm about to have a coughing fit, I think. Just really to emphasize as well that from a financial perspective, it always comes down to money, doesn't it? Our activity today really does represent a very substantial return on the Sharland Foundation investment. So to the tune of about 7 or 8 times return. So this return on the investment of more than £6 million, it has come from research grants that we've been successfully able to apply for, PhD studentships and the like. So this slide really just summarises some of the large-scale randomised control trials that have been worked on via the network and that have been externally funded. And all of these grant applications that we submitted, we were able to include in our application a demonstration of how we had systematically been working towards developing the evidence base that had led us to be able to submit those applications for the large-scale randomised control trials. And it's just important just to sort of final up to say as my sort of last thing, I suppose, that this return on the investment we've been able to do, we've been able to achieve that with an incredibly small part-time staff support structure. So yeah, it's really lovely to be able to see where we've been able to get to with that. Okay, so that's me finished.
Thanks very much. you made it just to the end, Corinna. Oh, well done. Wow, that's an extraordinary body of work that you've described there. It really is remarkable. I've put the link to the CEU in the chat, and we're just 1 minute left. But if I could ask you, like, evidently within our own community, the behaviour analytic community, there's an ongoing discussion about how we communicate our science. And I noticed you touched there on other professionals, communicating with other professionals. So what are your thoughts, or if you had some advice for us, for me as well, on science communication or communicating to others? What would you say about that?
Oh my gosh, yeah, where to start, I suppose, with that. I mean, this might be a little bit contentious to say it, but I will say it anyway. You may have noticed in the way that I was talking and in my slides, I didn't really talk about applied behaviour analysis or ABA. So unfortunately for us, that term ABA has got a really bad rap. It turns some, I'm not saying it's the right thing, but it definitely turns some professionals off as soon as they hear ABA, their ears close and they don't want to know. So, you know, I kept saying behaviourally based interventions. That's the term as the network we are tending to go with. And we're not getting the resistance with the dissemination. You know, the professionals that are not in our field seem to be much more open to what we are trying to say when we talk about behaviourally based interventions, and if we're talking about ABA. So I would say that's possibly one thing to consider. And I mean, I'm not saying of course, that that's right. I'm saying that's the way it is, unfortunately.
Yeah. So maybe we should hold our language a little bit looser and be more flexible with it, to borrow some ACT metaphors. Right, thanks very much. We're over time. That was a real pleasure. And we'll post it on our website afterwards. So if you can get your CEU now, or get it afterwards. Thanks so much for your time again, Corinna. Bye.
Okay, thank you. Bye-bye.
Bye, everybody. Thank you.